Hello everyone, welcome back to my channel. I'm Dr. Anuj, a first year MD Medicine resident at GMC Nagpur, and welcome back to my channel. In this video, I'm going to be doing a short Q&A where I'll be answering some of the questions which you guys have sent me over on Instagram and sort of giving you a life update along the way. So yes, welcome back, and it's really nice to see you here. We're starting off heavy with the first question. Doing all this for years, is it worth it? I mean, are you happy? So if you can't already see, I am a bit sleep deprived, but I am definitely very happy. There are very few jobs in the world which give you as much satisfaction on a day-to-day basis as being a doctor does. When you actually see your patient recover from the help that you did, from all the treatment guidelines that you followed, and also by counseling the patient, it is so satisfying to see that. And yes, it takes quite a long time to become a doctor, but I would say that it is one of the best feelings in the world. Yes, the path is difficult, the journey is difficult, but when you actually reach at the top, when you actually get what you want, when you actually follow your dream, it really is worth it. So for all the NEET aspirants who are watching this, don't ever think that I don't want to take medicine, I don't want to take MBBS as my future. If you are really passionate about a subject, I think that you should absolutely go for it. The next question is, what did you do during the last months of NEET exam? I just can't calm my anxiety down these days. So yes, for both NEET PG and NEET UG, very few months are left, very few days are left. And the number one tip that I can give you is sleep well. If you are sleeping well on a day-to-day basis, I am guaranteeing you that you will be lowering down your anxiety by quite a lot. Next, make sure you make a daily schedule and follow that schedule to the T. Whatever you are trying to learn that day, make sure that you are getting that done on that day itself. When you actually see the progress by your own self, okay, I am making a list of 10 topics which I want to study, maybe one test which I want to give, and if you're seeing all of that progress happen, you will definitely feel satisfied and it will calm your anxiety down. Next tip, don't talk with people that increase your anxiety. So you definitely know the friends that I'm talking about, which whenever you talk to, always give you some sort of complicated question which you don't really know the answer to, and you know that question is never going to be asked in the exam. So that's just wasting your time and increasing your anxiety, so stay away from such people. And thirdly, try to meditate if you can. Just 5 minutes of meditation in calm, quiet space, and just trying to calm your mind down, just going with the flow of time and feeling the present moment as it is. Just try to do that and see if that works for you. It did for me, and I'm sure it will work for you too. Overall, I think the best step would be to prepare as much as you can for the exam, because if you prepare well, you don't have to be scared about anything. Personally, during the last few months of my preparation, apart from all the things which I talked, I studied a lot. Like, I mean a lot. For both my NEET PG and NEET UG, I studied like crazy, and that's what you have to be in order to pass an exam. Next question is, what is your stipend and how does it compare to your YouTube earnings? So YouTube earnings, though, it's uncountable, like totally uncountable. I can't even count the amount of love and blessing that I get from YouTube. Talking about the stipend, I am posted as a resident in medicine, and over here in Maharashtra, we have, in Nagpur specifically, we have a salary of 91,000 rupees a month, which is, I think, good. It is enough for the amount of work that we are doing every day. For example, I'm posted in the ICU right now. It is what? It is 1:05 in the night that I'm filming this video. Yeah, I got free at around, I would say 12:30. In the morning, my day starts at 8. So no holidays, nothing. In the morning at 8, and by the night, by 12:30, I get to go back home. So that's one of the best things, that in the ICU posting, I'm able to come back home, I'm able to shoot, I'm able to record stuff and do my own things. But at the same time, it's a lot of work as well. So 91,000 is a good amount for anybody who is, I think I'm 24 years, so I'm 24 years old in a good city. Yes, 91,000 is good amount. Almost 1 लाख रुपए मिल जाएगा अगर तुम थोड़े से पैसे इन्वेस्ट कर दो सही जगह पे. तो YT earnings के लिए तो I think a separate video deserves. So if you're interested in watching that video, please make sure to comment down below what is your YT earning. So we've got a very interesting question, the next one. Doing PG, MD or DNB from a good institute away from home or a decent one in your hometown? I think to answer this question, I'll tell you a bit more about my psychology. So I think that your MD or DNB, whatever degree that you are taking, it is going to be extremely challenging for your mental health, your physical health, your spiritual health, for your relationships, for your food intake, everything. It's going to be one of the most challenging periods of your time, and I'm currently going through that. And I can't tell you how good it feels to have the support of my home, of the support of my friends, of the support of my family when I am, tired, I am overworked, I'm exhausted, and just being able to see them kind of melts all of that stress away. Next, I also feel like there should be less amount of things that are wasting your time and energy. For example, if you go back to your hostel and then you have to wash your clothes and do your laundry and do your bartan and do everything, that's gonna take up so much of your time. Versus if you live at your own home, everything else is taken care of. Just make your life as easy as possible during the residency time, because residency is going to be tough. But here comes the contrast as well. Please make sure that whatever college you are going to do your residency from is absolutely good, because there is no worse feeling than taking a college and it not being good for that particular branch. That's the thing, because then you feel trapped. You feel like I have taken this from my own choice and then I can't get out of this as well. So that's a big thing. So make sure you do good research about the college, and only go into that college if you're happy with the department and also happy with the caseload, the case inflow, and the day-to-day life of the residents present over there. Make sure to do detailed research before picking up any institute. If possible, work there and only then start to pick it up. In short, my advice would be, if it is a decent institute with good case flow and good hands-on, good learning in your hometown, then definitely go for it. Unless of course you want the best, most apex institute, and if you're willing to sacrifice everything for it. So for personally me, I am not that much into sacrificing everything of my life. I like to take life in a very chill manner and enjoy things as it is going on, and I think my friends would agree with that statement. So that's why I'm very okay with taking a very, very decent, in fact one of the best colleges at my own hometown, even though I had the opportunity to take higher up colleges in different cities. Next one is a statement, nothing much, but hope you do well. I do miss your day in your life vlogs. Oh, thank you so much. I miss making them. I think I will be able to make them next in maybe 7-8 months whenever I become JR2 because in JR1 ship it is simply not possible for me to sit down and shoot. In fact, making this video is taking up so much of planning and everything, to manage everything in time so that I get back to home and start filming. So that's really good. But day in my life videos, so the thing is, my ideology is I don't like to shoot inside the hospital. I don't like to show any of the patients. I don't like to talk about their real life personal stories. Okay, I do talk about case stories, but I don't talk about personal stories. So if you talk about very personal stories, that does get views, but I don't like to record inside. I don't like to talk or disclose any info about my patients. Yeah, shooting inside the hospital, I'm totally against it. And since my life is practically the hospital at this moment, I don't think I'll be able to make a day in the life anytime soon, but I might be able to make a night in my life, I guess. Evening routine or something like that. Let me know if you want to watch that. But yes, even I do miss my old days. Whenever I am walking down from my ICU to the labs or going from one place to the other, sometimes suddenly I start to think about how good the old days were, where I did not have to work this much, where I would just be at home chilling, enjoying my life, playing video games all day on my PS5, talking with my friends, going out almost every day, just enjoying life as much as possible, going on trips, going on different talks. But yes, that's life, and everybody has to go through residency if they want to become a good doctor. So yes, thoda बहुत sacrifice है, but even I do miss the old days. But don't worry, life ऐसी होती है. एक phase आता है, दूसरा phase आता है, तीसरा phase आता है, and it just goes on. I think that on my YouTube channel, my audience has grown so much. I saw a comment recently which said, I have been watching your videos since I was in class 7th and now I'm appearing for NEET. I think I've given the form for NEET this year, and that's crazy to think about that. Literally, some of you guys just grew up watching my videos, and that just melts my heart. So thank you so much from the bottom of my heart for that. Okay, next one is how you're managing your social life, professional life and study. My bro, abhi I am not able to manage anything. So social life, practically it is none, because यार कहीं जाने का ही time नहीं है, कुछ मिलने का ही time नहीं है. But there is a lot of social life within the hospital itself. I meet so many people from almost all the departments. Medicine is such a core thing. Like everybody has so many calls which they are sending to medicine. So from ENT you get a call, from Obs Gyne you get 10 calls a day. Then you get calls from Ophthalm, maybe some other departments. Like this, I'm able to meet a lot of my co-JRs. When I go to radiology, when I go to pathology, there I meet my co-JRs. So I think that overall in this old place of GMC Nagpur, but with new people, I am socializing a lot every day in the hospital itself, and not anything outside the hospital, but within the hospital, whatever time that I'm spending there with my friends, with my co-workers, with my colleagues, I'm absolutely enjoying that. The small conversations I have with the patho department people when I'm there running the CBCs, or the small conversation I have with the radio people, or when I'm just walking upstairs and I meet somebody, or when I'm going downstairs in a lift and then I meet somebody. When I'm attending a call, and then I see a patient and I talk with the resident. So there are so many moments where socializing happens in the hospital in a very untraditional manner, but it is the best part. I'll tell you a story. For the first around 1 month of my residency, I was completely alone in my ward. So I was in my ward, but I was completely alone. I was the only resident posted over there as JR1. So I had to, be there the entire night, every night, and I used to be, alone, and I really did not have anybody to talk to except for sisters. So I used to talk a lot with the sisters and just, talk about life, talk about things. There is a table and there are so many notes which I have to complete, and there's a sister sitting next to me, and we are just talking while I'm writing the notes and she's completing her files. So that's the kind of socialization that happens in, hospitals. Another thing which I remember is still sitting in my ward, two of my surgery seniors coming up for a call that had been sent, and all three of us sitting down and talking about life while they were attending the call and I was writing my notes, all at like 2 in the night. That is the kind of fun that is happening in residency, and it's really really nice. A lot of socializing. बहुत अच्छे दोस्त मिले हैं. I'm very lucky कि इतने अच्छे दोस्त कहीं मिलते नहीं है, पर काफ़ी अच्छे मिले यार. So I'm very happy with it. Most importantly, two of my very good friends, Aditi, Radhika, both are in my own college, so I meet them all the time. So yes, बाकी social life तो कुछ है नहीं. Professional life, I have already made videos till I think August. So yes, I'm still recording some videos. So I don't think that professional life is a big hassle. And lastly, study. I am not studying anything. The only study which I am doing is learning practical things, hands-on things. How are you feeling about general medicine? Do you regret not taking general surgery? What will you suggest for your juniors? So I say this quite a lot, but I'll say it again. Every day I thank myself that I did not take surgery. It would have been a catastrophic decision on my end. So I am loving general medicine. I'm loving each and every single part of it. There is so much to learn and there is so much satisfaction, guys. Medicine जैसी branch ही नहीं है. It's not possible to have another branch like medicine. You are seeing such a variety of cases every day, okay? And you are seeing the dramatic response of different interventions that you do. For example, a patient has a tachycardia of 150 and you just give him one drug, metoprolol. You see the tachycardia come down. Maybe somebody has got some allergic reaction. You push a hydrocort and then you see the reaction settle down. Maybe somebody has a flash pulmonary edema. You give them elastics and see how it works magically. So that's the beauty of medicine, that you see real things happening real time. In the ICU in the past 2 weeks, I have given I think 20 CPRs, so 20 cardiorespiratory arrests तो easily हो गए अभी तक के. And when you call a CRA and then you start doing your CPR, and after the CPR 5-6 cycles of CPR and everything is given to the patient, and then you see a rhythm on that ECG strip and you know that you have successfully revived a patient. That's the real feeling of a doctor, that you have pulled somebody back from heaven or from hell and put them back on the face of the earth, and that's a real satisfaction. And one wonderful story is that one of our patients who survived a CRA and was successfully resuscitated is now kind of regaining consciousness. So that's incredible from our end. So medicine is an incredibly satisfying branch. It is one of the best branches that you can take. It requires a lot of dedication, a lot of hard work to get into it, and also the same to survive in it and to learn in it. So that's the thing. It all depends on how much are you enjoying it. So for the first few weeks of my residency, this all was not coming to me. I was just focusing on very much surviving. But slowly and slowly, as I've adjusted more, I am enjoying this process of learning in practical manner much more. About general surgery, I do miss surgery sometimes, but we do minor procedures from time to time. I've done bone marrow aspirates, I have done lumbar punctures, I've done central lines, I've done DLCs. Seeing that, those are the few surgical procedures which I like, and I'm happy with that. I get to take 2 sutures for the central line and I'm very happy with that. No need to, open the abdomen and do complicated procedures over there. Plus, I feel like medicine is learning the human body in the most detailed way. So I really like that part about it. What will I suggest to my juniors? Follow your passions. If you're passionate about surgery or orthopedics or gynecology, don't let anybody change that. Follow your dreams. Next question is how to master clinics in 3rd year. यार नाम में ही तो तुम्हारा आंसर छुपा है. How to master clinics, and that's the answer: mastering clinicals. So mastering clinicals is my particular course which I have designed completely for you to be able to master your clinical skills, from general examination to systemic examination to how to answer the viva to history taking, every single thing in a great detail. You can just go watch mastering clinicals and it will be very nice. I've given you exact practical demonstrations on what to do in the viva with a real patient. Was not really a patient but a paid actor, but some people were like, "Tu patient क्यों use कर रहा है भाई?" अरे यार, पेड एक्टर है, समझो तुम बात, डेमोन्स्ट्रेशन करके दिखाना है. So yes, go check out Mastering Clinicals, link in the description. Apart from that, just read good clinical books and also standard books. Most importantly, attend your postings. मुझे पोस्टिंग में दिखने चाहिए तुम कल. सब लोग मुझे वार्ड में चाहिए, मेरे सारे जूनियर्स जितने भी है, और सब लोग केसेस लेंगे. What do you think about FMGs? FMGs are one of the most sweetest people that I've met so far. I have got a few interns who were FMGs, and the time which I had with them, incredible. One thing which I've noticed about FMGs, super sincere about the work which they are given. They try to complete everything, and they are really positive about everything. I have not seen any FMGs complain a lot, even though they are going through a lot. They don't complain that much. So that's my honest opinion about FMGs. There is no difference between IMG FMG, but FMGs are more sincere. I would say that. Next question is interesting. Karti K. Garg, how to manage relationship with NEET PG preparation? यार कार्ति, मैं एक चीज़ बताता हूँ कि it all depends on what kind of a relationship do you actually have. If it's a supportive one where you are actually supporting each other, where you are actually building each other up, and you are actually understanding what each one of you is going through. For example, if you get a bad GT score and your partner gets a good GT score, it's their responsibility to counsel you and motivate you to improve your marks. Whereas if you're not studying, it's their responsibility to make you sit down and study. So it all depends on the kind of relation that you have with your partner. If it's the one where it's completely toxic, like they are not able to understand you, like what you are going through, what are the phases that you are going through right now. Maybe you are busy in an internship posting and you are being stressed about the exam, and then they are trying to fight with you. I don't think that's a healthy way to do that. So it all depends on the kind of relationship that you have, and if it's a good one, I think that it's a blessing because you get a study partner and you can both crack the exam together. I hope I have answered your question. Lastly, sir, how do I start preparing for NEET PG? Just ended with final prof, so you're officially an intern. Make a list of your schedules as to which are the postings that you're going to be posted in what months. Find out heavy posting kaun si hai, light posting kaun si hai, and schedule your revision cycles accordingly. In the light postings, you have to study as much as possible, at least 10 to 12 hours a day, and in the heavy posting, at least you have to study 1 to 2 hours a day. And start giving GTs today. Today is the day that you give the GT after watching the video. So that's in short how you study for NEET PG, but for a very big detailed plan and outline on exactly how to study during each phase, 2 months before the exam, 2 weeks before the exam, on the day of the exam, how do you exactly prepare the notes, what is the best way to concise your notes, how to use the BTR, how to use Marrow or any other resource that you have, everything. I've made an entire course called Blueprint, which is the ultimate success blueprint for NEET PG. Anybody who watches that with dedication and follows every single word that I say, there is nothing stopping you from cracking NEET PG. I guarantee it. Varna paisa return. So yes, you can also go check that out. Link in the description. And yeah, thank you so much again for watching my videos and supporting me. It's your friendly neighborhood resident, Dr. Anuj Pachhel, and I'll see you in the next one. Goodbye.